So I think we can start. Today's topic is pharmacokinetics, and pharmacokinetics is a division of the pharmacology that uh, uh, that studies uh, of the interaction of the human body and the drugs, and how the uh, human body will modify the drug, and what happens with the drug uh, when it passes through the different stages of the pharmacokinetics, uh, and the stages of the pharmacokinetics are absorption, distribution, metabolism, and elimination. So these four stages uh, can be very fast or very slow depending on the type of the drug and the different routes of administration, and also the type of the body. And it's important to understand every step, so that allows to predict uh, the concentration of the drug in the plasma, so concentration in the plasma that it is connected with the concentration in the tissues, and this is an important feature for evaluation of the treatment, and sometimes is monitored, for example, for the cancer drugs, and also for those drugs where the drug plasma concentration can be easily changed, and that so the even small change in the plasma concentration may result in the increasing of adverse effects. So in these drugs, the plasma the physician will usually opt for the monitoring of the plasma concentration. So the drugs, so the absorption starts at the after the administration of the drug, and uh, depending on the way of the administration, absorption can decrease the amount of the drug initially, so that leads to the decrease in the drug plasma concentration. So if we so the lower the absorption is, the uh, uh, the lower will be the bioavailability of the drug, because not all of the dose of the drug will be absorbed to the blood. So the uh, absorption action is usually takes about uh, from 5 minutes to up to 1 hour, and in case of the uh, oral administration, depends very heavily on the stomach state, like the type of the food and the time when the food was taken, uh, and the drug was administered. And uh, after the absorption, the distribution phase will follow. So and actually it starts the distribution phase will start immediately as when the first part of the drug will be absorbed. So these are continuous processes, and distribution is between the blood and the tissues. It's also between the different tissues. So this phase takes as long as the drug is uh, in the body, and may take up to 4 hours or even longer for some drugs. The more lipophilic drugs will distribute better, and the volume of distribution will increase if the drug is more lipophilic, because it will pass through the phospholipid layer, and uh, also the hydrophilic drugs will not. So and so that is why hydrophilic drugs usually have lower volume of distribution, and some drugs can distribute to the central nervous system and pass through the uh, uh, through the
Blood-brain barrier.
sorry.
It can pass through the blood-brain barrier.
Yes, they pass blood-brain barrier, and they distribute well to the central nervous system tissues, because they can pass through the tight junctions uh, uh, in the uh, capillaries of uh, the uh, or, that prevent this distribution usually. So, and moment. And also drugs can distribute to the uh, uh, to the uh, hidden volumes of distribution, like for example in pregnant women that can be the fetus, and also in cancer patients that can be the tumor of the specific organ, for example the breast tumor, or the tumor of the particular lung tumor, or the uh, so, and uh, also the the molecule the charge of the molecule also will influence the distribution phase, because usually neutral molecules distribute better through the B layer of the membranes, because they will not be attracted neither nor the uh, so, and uh, the this phase depends mostly on the chemical structure of the drug, but most of the drugs are uh, mm, are neither lipophilic nor hydrophilic, and also usually are neutral molecules, not charged. And then the next phase is the metabolism. Metabolism is uh, takes place in all tissues, but mostly in the liver, because most of the enzymes that transform the drugs are located in the liver, and the liver enzymes are for the enzymes of the cytochrome 415. They uh, they transform the drug in two types of the reactions, phase 1 and phase 2. We will talk about them later. And then the uh, uh, metabolism will prepare the drug for the elimination, and because usually during the metabolism drugs will be more hydrophilic, uh, because of the attachment of the hydrophilic groups, and also maybe ionized so that increases the rate of the elimination, usually with the urine. So, but also drugs can be eliminated by other ways, not only urine, but also by bile and feces, uh, and also with the sweat, saliva, and breast milk in case of the uh, breastfeeding woman. Uh, and that is why it's not recommended for most of the breastfeeding uh, women to most of the drugs are contraindicated for breastfeeding women too, because most of them will be eliminated by the uh, breast milk and then enter the uh, the infant body in the higher concentrations that are recommended for the infants or even contraindicated at all. So these are the main four uh, steps: absorption, distribution, metabolism, and elimination. So for absorption to occur, we need first we need to administer the drug, and there are plenty ways of the administration. So, but in general, we can divide uh, all the ways of administration to enteral. So enteral are through the uh, oral way, so mostly oral. So enteral means that through the GI. So this is mostly actually oral administration. And then parenteral means that it damages the skin, and most commonly used parenteral ways are intravenous, intramuscular, and subcutaneous. So intravenous administration is usually done for the veins at the hand. So and the is most fast administration, and there is no absorption in case of the intravenous administration, as the drug goes directly to the blood flow, and usually uh, the it's only used when the emergency cases, or when the other routes are not available. Then intramuscular is usually done to the uh, at the place where the large muscle is located, uh, and can be uh, used very commonly. So it's most common way of the parenteral way of administration, usually used in hospitals for the treatment of patients. Uh, and also subcutaneous way, used mostly for the vaccines, and also for insulin, um, and for those drugs that require long acting, uh, and all there can be distributed slowly from the place of the injection, because subcutaneous way is not the fastest, but it's is the longest duration of action. So then there are other ways. So third type of actually other ways, and there are so many other ways, and like for example topical, like administration of the ointment to the skin, ointment or liniments, or any drugs that are applied directly to the skin without damage will be a topical administration. And also uh, the otic way is used as a drops to treat the diseases of the ear, usually the inner ear, because it's not permeable for the it will not be absorbed to the blood, but will make a local action in the ear, because most of the drugs that are injected and taken orally will not absorb well to the ear because it's located in the central nervous system and also protected. And then the ocular also will act only to the eyes. Usually it's eye drops, and eye also doesn't have blood circulation. That is why drugs will not penetrate well to the eye. So in case of the high concentration is required in the eye, for example for the antibiotics for the treatment of eye infection diseases, the uh, the ocular way is used for the topical as a topical way, and then inhalations are done for the treatment of the asthmatic patients, and these are usually bronchodilators, but also can be used uh, for some other purposes, uh, and sublingual and buccal ways are also very fast ways, like for example nitroglycerin is administered sublingually, can be can start effect in about 1 minute after administration, because uh, this absorption is done through the capillaries of the mouth, that and small molecules like nitroglycerin can easily penetrate through this mucosa and to the capillaries under the tongue, and that gives a good bioavailability, because usually nitroglycerin taken orally have a very poor bioavailability because of destroyed in the stomach. So, and buccal are usually the patches that are applied to the cheek, and they also provide a long acting duration. Then transdermal patches are applied to the clean skin. Usually the skin, usually the place with the muscle, with the large muscle is selected, like the triceps or biceps, where um, the fat layer is low because the absorption is reduced by the fat. So, and also these patches are not effective in some people with the weight over than 150 kilograms and more. So then epidural is used for the pregnant woman that are afraid of the pain. So this when the morphine actually injected directly to the spinal cord, and because morphine will not penetrate through the uh, uh, blood-brain barrier, and that prevents the harm for the fetus, because uh, fetus uses the same circulation of the blood as the mother. So, and the last but not the least is the rectal way of administration. Rectal is used uncommonly because it's not very pleasant, but may be effective because absorption is also will bypass the liver enzymes, and that is why some drugs that are heavily metabolized by the liver can benefit from that. So that are main ways of absorption, and there are also new ones like but these are most commonly seen ways of absorption, and most commonly used is oral tablets. So um, like 99% of the all the medicines are tablets or capsules or covered, or the tablets covered with the protective layer. So mm, so this is most popular type of the administration, and also the type of the drug. So tablets are most commonly seen. Uh, in hospitals, usually uh, the parenteral ways are preferred because they are more reliable and easily done. However, latest research suggests that, yeah, tablets are also should be used in hospital settings to reduce the pain for the patients, especially in the elderly. Okay, and then um, the so the type of the injection can be different depending on the angle of the syringe. For example, here the intramuscular injection is shown, subcutaneous injection. So uh, and actually uh, here is deep subcutaneous injection, and the difference in the concentration in the plasma seen after these injections. So you can see that the intravenous injection will give the higher concentration and faster, while the intramuscular injection will lead to the slower uh, increase of the concentration in the plasma because of the absorption from the site of injection. And the for the uh, absorption, different mechanisms are used. Mostly the passive diffusion is used for the most drugs, and depending on if the drug is water soluble or the lipid soluble. So water soluble drugs are hydrophilic drugs, and lipid soluble drugs are the lipophilic drugs. So this way they will go through the cell membrane in different ways. So passive diffusion is mostly through the pores, while the lipid soluble drugs can pass through the membrane. So then facilitated diffusion is actually can be seen for some drugs that have a special transporter that can move the drug from one side of the membrane to the another side. And for those um, or enzymes that require ATP or energy, it's called an active transport because it will use the uh, energy of ATP to make the transfer. Then the bioavailability is the uh, uh, amount of the drug that is seen uh, in the blood uh, compared with the maximum amount that is seen after the intravenous injection. So uh, to measure the bioavailability, we need to plot a graph with the concentration of the drug after the intravenous injection. So we plot a graph by like measuring the plasma concentration every half an hour, for example, and then uh, we give the patient the same drug but orally, and also so the same dose orally, and then we measure concentration again, and then we plot two graphs, and then measure the area under cube for these graphs, and then divide the oral to the IV and multiply by 100 so we can see it in percentage. So this is the bioavailability. So uh, and after the entering uh, the the blood, the drug will go through the systemic circulation, and the circulation of the lower abdomen will go through the liver before it will go to the heart. So that is why when we make an intravenous injection, first it goes to the liver, and then through portal circulation returns to the heart. So that is why if the drug is targeted to the heart, so for the treatment of the heart disease, so then it first will be inactivated in the liver, so that should be taken into account. So, and with every circulation, the liver will decrease the concentration of the drug because of the metabolism, and that will lead to the decrease in the effectiveness of the treatment. So, and it will require additional dose. So then the elimination phase can be so if you look at, if you plot the concentration, plasma concentration of the drug, you can see like after the for example intravenous administration, the concentration is the highest, and then there is a distribution phase when the drug concentration in plasma decreases because of the uh, because of it passes to the other tissues. So, and the higher is the volume of distribution, and the higher will be with the lower will be uh, the concentration here, so it will lower more. And then the elimination phase will decrease further the concentration of the drug in the plasma, but that usually takes more time because the liver enzymes are limited, and they have to metabolize the drug before it can be eliminated. And also, depending on the route of elimination, it can also be limited by the elimination, like for example, if the eliminated by the urine, then the urine formation is also limited. So that is why this phase usually takes several hours. So here actually it's 3 hours. So 1 hour of the distribution phase, and then 3 hours of the elimination phase. So most drugs have this type of distribution. However, there are so there are so this is actually called exponential distribution, but also some drugs will show uh, the straight line, so it's not exponential, and then it's so that they have zero time ele elimination time. So uh, and so here actually we can see the we can find also the concentration that uh, to predict the distribution of the uh, of, of, of the drug. So then there are some parameters that can measure the absorption and elimination of the drug. So, and again, if we plot the plasma drug concentration to the time, then and we, for example, start the infusion of the drug. So if we administer the drug by infusion, plasma concentration will increase until it will reach some value that is called steady state concentration. At this state, uh, the the speed of the uh, uh, absorption is equal to the speed of the elimination. The uh, so that is why the concentration will not increase or decrease and still and stay. So this is called a steady state concentration. So if we take it as 100% and then uh, multiply by 2 and then look we will draw a parallel line to the x-axis and the time at the place of the crossing we will plot another line that is parallel to the y-axis. We can find a steady state time, so the half elimination time. So this and this constant is, so this time is constant for the particular drug. So it doesn't depend on the concentration of the drug. So we will always reach this time in for example 2 hours for the particular drug. So and it is considered, so and if we can mm, we can uh, we can agree that like the in about like 3 and 3.3 times this half elimination time, the about 90% of the drug will be eliminated. So and that actually so the drug will be almost completely eliminated after this time. So this um, can be useful. So when you want to know when the drug will the body will be free of the drug, so you can administer a drug that is incompatible with the current drug. So there will be no interaction between the drugs. So this time is shown like increasing concentration, but the same graph will be with a decrease of the concentration because usually these drugs will distribute both ways the same. And if we compare the oral and intravenous administration, the difference in the plasma concentration will be seen like the oral administration. With the oral administration, there are some fluctuations in the maximum and minimum concentration. So while with the intravenous administration, the concentration is more steady. So and for example, if we change the dose with the intravenous, it will change faster because these fluctuations actually, the lows here and the highs here will be very close. So and the same if we decrease the dose. So that is why intravenous infusion is preferred in the hospital, because oral dose will give a little increase and decrease. So if fluctuations in the plasma drug concentrations. So if these fluctuations will be even higher, then actually they can even sometimes lead to the adverse effects, or well, they can be even lower. So this like splotch. So then the drug concentration can drop below the required. So that is it for today, and thank you very much for your attention, and see you in next week.
Thank you, so Doctor. Thank you.
Thank you
Can I
very much.
ask you a question?
Yes, if you have any questions, so you are welcome to ask
Yeah,
questions.
because I didn't understand well when you were talking about the drugs can affect the breastfeeding woman.
Yes. So what is your question?
What kind of, like, what is the classification that will allow us to know if a drug will pass through the membrane of the breast or
There is no a particular
not.
classification. Ashraf?
Yeah, there is no classification.
No, there is no classification, but most manufacturers report if the drug will pass through the in breast milk or not, and most drugs will pass. So, like if the woman is breastfeeding, so to make one should make sure that the drug is not passed. So usually is consulted with the OB/GYN about that. But most drugs pass. So unfortunately, almost all drugs pass, but some drugs pass in high concentrations and others in lower concentrations. Those that
So,
are in lower concentrations can are not harmful for the infant. So that is why they are not contraindicated during breastfeeding. So
so
others
I think the manufacturers put like a note so they can say if it's a high concentration or low concentration.
they don't put note about the concentration, but just they for the those that are contraindicated during breastfeeding, they write contraindicated during breastfeeding. That is it.
No, I mean in the like the producing in the paper that exists in the box of the drug.
So in the paper of the box,
I mean the instructions of consuming the drug.
yes, in the instruction, the only thing that is stated is if it's contraindicated or not. The concentration you have to ask about that origin. So,
Ah,
or
okay.
just like in the literature board, like there are some recommendations about that, like which drugs are safer, more safe, for example, for the
Yes,
if
for breastfeeding women. Yeah.
yes, not for breastfeeding women. I mean, for example, if the woman has a high pressure and she takes a medication for that, then we can select the drug that is less harmful for the infant for the duration of the breastfeeding.
Yes, of course.
Okay, the second question, if it's possible.
Yes, sure, sure.
Yeah. We talked about also the epidural administration of the drug. So you said that it's more safe for the fetus than the maybe other administration like inhalation of anesthetic products. That's it?
I thought about the fetus because epidural is used for the pregnant woman during the delivery. Uh, it's still not completely safe, but it's more safe than the normal intravenous administration. So, because usually the analgesic morphine is administered intravenously, and if administered intravenously in high doses, it will penetrate through the barrier to the fetus. So that is why they administer it epidurally.
Oh, okay. So if we administrated the epidurally, that means that the concentration of the drug will be less and will access less through the membrane of the fetus.
That means that it will be high in central nervous system, but in the peripheral blood, it will not be high because of the blood-brain barrier.
Okay, it's clear. Thank you very much. That's all for me.
So you're welcome. Any other questions?
No, I think it's
No? Okay, good then. Thank you very much for attending, and see you next week. Bye bye.
Well, see
okay.
you
Thank
next
you.
week.
Have a nice evening.
Have a nice day.
Thank you very much.
Bye.